Hello, everyone. Thank you for joining us, everybody. And this IoT Sparks. And today we are going to talk about IoT in healthcare sector. And I'm not alone in this webinar, but I'm with three amazing speakers from three different companies. And let me introduce them, and then we'll start. Just as an introduction, I wanted to share with you all that this webinar is part of a webinar series we are organizing, where each time we will talk about different different solution, and likely enough, IoT is full of great example. We call that Sparks, IoT Sparks. This is where the name is coming from. And today we will focus on the healthcare sector with an asset, a tracking solution. But you will discover more in the next over the next hour together. So let me introduce the you can see already. Yeah, in welcome Andreas Ekengren from Traxmate, is VP Business Development, and then Kevin Young, Product Director, SeedStudio, and my colleague Ingi Diego is a development manager and keynote speaker. He works here with me in LORIOT, and the three of them have in common the great passion for IoT and to see how technology and IoT can actually solve real world problems. Companies, in this case, we will explore the healthcare sector with an amazing solution, I would say, and we go through each component of this solution. So from hardware to software to the platform, allowing, say, create the magic of IoT. So without any further ado, let me hand over to Ingi, as he will start the presentation. And I will ask the other speakers to switch off the camera and mic, so the experience for our audience will be best. Thank you very much, and see you at the end of the webinar. Let's start.
Thanks, Dario, for that introduction. Hello, everyone. My name is Ingi Diego, Business Development Manager here at LORIOT. And as mentioned, we're joined by SeedStudio and our friends Traxmate Combine to speak a bit about how tracking is being used in healthcare. So first off, who is LORIOT and why are we talking about this subject? Well, LORIOT enables long-range, low-power IoT devices to communicate securely, reliably, and at scale. So we're known for reliability. We've never focused on selling hardware such as devices or gateways, providing amateur hobby networks, public networks, or crypto mining. We're focused solely on the network management system for LoRaWAN and MyOT. LORIOT offers this solution to prevent siloed data, and it streamlines and simplifies managing that network. Our customers want the control, SLA, and support that comes with a private network. That's why the LORIOT network management system is used by customers such as Porsche and BMW for tracking vehicles and tracking workers and vehicles in Saudi Arabia. So why LoRaWAN? Why is LoRaWAN being used in this instance? Well, LoRaWAN stands for Long Range Wide Area Network. It's a license-free radio band being utilized so that you can build your own network when and where you want it. You don't have to rely on cellular providers. The LoRa technology is well suited because it provides the most efficient means of transporting data at distances of up to 20 kilometers in rural areas and 2 to 3 kilometers within cities. The medical and healthcare sector is perfect for LoRaWAN for the same reason LoRaWAN has done so well in smart cities, smart buildings, and oil and gas. Because when you have large buildings and obstacles made of concrete and steel, you need a radio signal that can penetrate through that while using very little energy. And while hospitals can often be in older buildings with thick concrete walls, Wi-Fi, Bluetooth, and cellular aren't able to penetrate deep within those buildings, and that's why LoRaWAN works very well. Regarding the security, LoRaWAN is using the embedded end-to-end AES 128-bit encryption, so it delivers a high level of privacy and protection. It's the same encryption that's used by ChatGPT and Google's web server connections, as it would take 2.61 trillion years to hack this with a supercomputer. And every time you reset the devices, you reset those keys. So it offers a very high level of privacy and security. So while creating your own infrastructure can be as simple as plugging in a few gateways. By bringing in added value from other solutions, you can make it a much more attractive proposition. Some use cases that we're seeing within the healthcare industry are the patient care, the wayfinding, how patients get from one area of the hospital to another, the proximity detection and contact tracing that have been used during COVID, or wearable health monitor and vital signs. We have temperature monitoring, whether it's the food in the cafeteria or it's the vaccines and medicine in the refrigerators. You want to know that they've been stored at a proper temperature. It can also be used for monitoring the patients in isolation. We also see it being used in the smart building aspects, desk and room occupancy. Is there a patient in such a room? Is this one occupied? Where can they move people? They can make proper use of all the facilities. Door and window monitoring to make sure that those doors and windows are kept closed when needed, and monitoring the HVAC or predictive maintenance on pumps and different things like that. The smart badges and tracking are very good for the panic buttons and all that we'll get into very soon. So for the actual use case that we're talking about today with the SeedStudio T1000 trackers and then the Traxmate Combine platform, that solution doesn't just provide economic benefits, but also a quality of mind, and that's to do with the patients. Because studies often show that Alzheimer's patients tend to wander off at night when the facilities have the lowest number of staff working at that time. So these early warnings are crucial. That's why the trackers are designed to be wearable, which enables that patient monitoring, and the battery life is very long. So it can also be utilized with fall detection to let them know if somebody's fallen out of bed and somebody needs to go and get them. We have the nurse call and panic button so that the patient can notify somebody that they need help, or a nurse can notify their colleagues that they need help, whether it's helping somebody in a room or it's sexual harassment. This panic button is very vital. Also, this data can be used very well to track the scheduling of daily resident activities, billing, productivity, things like that. And then obviously access control to know who has access to what rooms or facilities or assets within that hospital. So how does it actually work? You've got these SeedStudio T1000 trackers, you've got LORIOT, and you've got the Traxmate Combine platform. How does it all come together? Well, here we have the bidirectional communication with LoRaWAN, all the way from the device through the network server up to the platform. So these trackers are broadcasting a message whenever the panic button is hit or certain parameters are met. Then it sends a message out, and any gateways within range will receive that message and send it to the LORIOT network server. That's where the brains of the operation is. So the network server validates if that device belongs to the network. It manages the gateways, the end devices, the applications, and users in that entire LoRaWAN network. Several gateways can receive the same message and forward it to the LORIOT network server, and it will deduplicate the data and then also decrypt and decode the data and put it into almost any application output that you might need. Most often HTTPS, WebSocket, MQTT, something like that. So now we see that bidirectional communication of the device through the network server up to the platform, and you have an overview of how this communication chain works. Now we'll hand over to Kevin Yang, who'll give a bit more introduction and information about the actual devices. Thank you.
Thank you, Ingi. Okay, let's. Hi everyone, this is Kevin from SeedStudio. Today we'll share what SeedStudio and the LoRaWAN tracker built for healthcare tracking solutions. So Seed was founded in 2008, and for the past 15 years, we provide IoT and edge AI devices for developers and system integrators, specifically for like the open source development board and a ready to use product, just like the picture showing on the right side. With over like 200,000 customers around the world, SeedStudio's product has been widely used in smart cities, agriculture, retail, and manufacturing. So what do we do? So what do we really do? We design and manufacture different sensors, gateways, edge devices, like the LoRaWAN event sensors and trackers, and the gateway to provide the network coverage and edge devices with advanced local AI computing capability, because you know AI is super hot in recently. Well, let's talk about LoRaWAN. Like just Ingi shared before, if you have some specific problems to solve, you can choose one of or some of the LoRaWAN sensors, like the tracker, and join the network, LoRaWAN network, just like LORIOT do, to send the data to the server. And the LoRaWAN server will take care of the device management and the data management. And finally, you can serve your end customer like hospital or the elderly people take care house with applications and solutions, just like what Traxmate do. So today, let's jump into today's product, Sensecap T1000, which is holding on my hand. It's just like a badge. You can wear it just like this. So why Sensecap T1000 should be chosen? Because like first, it has 3 methods of positioning: GPS for outdoor tracking, and Wi-Fi and BLE for indoor tracking. So it has seamlessly been tracked across indoor and outdoor. That's super important for the health tracking solutions. Next, the tracker has built-in sensors like the temperature and the light sensor to let you know the tracker's environment, and the motion sensor to let you know the moving status of this device. Also, it has a panic button here with an alarm buzzer inside for like some emergency situations. And most importantly, I think it offers an affordable price, what will help you save a lot of budget, especially in using large quantities. There are a lot of other features in the picture on the right side, like the non-battery life, couple of months, one charge, offline record storage for over 1,000 records. The waterproof rating will be IP65, and also it is certified by EU and US areas. You are free to go in those markets. And SeedStudio not only design our own brand product, we also provide the customization services, like the picture shown. The tracker can be customized to fit into your specific need, add or remove some features, new form factors, or customization framework developings. So like in the health care field, we can have some typical use case, like the asset tracking, to monitoring expensive medical equipment, the personnel safety, to monitoring the patient or elderly people, or the cold transportation monitoring. So to tell you more about the LoRaWAN tracking solution for healthcare, I will hand over to Andreas from Traxmate. Hi, Andreas, you can take over the control now. Thank you, everyone.
Thank you, Kevin, and hello, everyone. Nice to be here. So I will talk about Traxmate and a bit about what we've done with the testing. So let's start here. Traxmate, this is what we call ourselves, probably the best IoT tracking platform in the world. What is Traxmate? Well, we are just one thing. We are experts in indoor and outdoor location of assets or people, and that's it. Traxmate is a Swedish company and was founded in 2019. Though that time, the two founders realized after working over a decade with outdoor location that the need for both indoor location and a good platform to use different services was very good, very big. We have customers both in Europe, in Asia and the US, and been serving them for quite some time. What we are very, very extra proud of is the unique AI-based indoor positioning system, and we will look into that. But first of all, what is Traxmate? It's an IoT tracking platform, and that provides seamless indoor and outdoor location tracking as well as routing. And that works in both 2D and 3D with floor and room accuracy. To get the best position, we use a hybrid of several radio technologies: GPS, cellular, Wi-Fi, and Bluetooth. GPS and cellular for outdoor positioning, and Wi-Fi and Bluetooth for indoor positioning. Now, Traxmate is hardware agnostic, so we can use different types of trackers, and the SeedStudio trackers are some of them. We are also independent of network. What does that mean? Well, it means you can use, for instance, the existing Wi-Fi network in your buildings. With our artificial neural network-based algorithms, we reach an accuracy of down to 2 meters indoors. So, platform, the Traxmate IoT platform offers a rich feature set, and you can see some of the features here on this slide. It is web-based, so you can reach it from anywhere. You have the possibility to see the positions of an asset in real time and see historical movements here presented as tracks, upper right. You can see the location in 2D, very good for movements, and 3D to get a better view of on which floor something is. You can set up geofences and get alarms when an asset is out of an area, as mentioned by Ingi. There are also rules to get daily statistics, notifications via SMS, etc. We are working in different business segments, and today we are focusing on healthcare. And in healthcare, usually you're tracking equipment and staff. Also in the industry, where a specific use case could be pallets or tracking forklifts. Within law enforcement, of course, for crime prevention, and logistics, tracking containers or tracking trucks. That was that for Traxmate. So let's look at use cases. And I would say this is pretty much a recap of what we have already discussed. But let's look at them again. If you start with the customer service, you can seamlessly guide patients from arrival to the destination. Regarding safety, you can send alarms to get help from your colleagues. Cost savings, maintain your equipment and minimize unnecessary purchase. Optimization, you use the data, for instance, heat maps, to see staff and equipment movements and the utilization. And last but not least, time savings. Discover the whereabouts of your assets. Now, if you're a healthcare provider, you will ask, what's in it for me? So let's look at some hard facts. This is market data. So let's start with wayfinding. A hospital with 600 beds experienced a yearly loss of $220,000 in labor due to guiding lost patients. This is not only cost, but it is time, and the time can be spent on taking care of the patients. So look at the next one, asset tracking. According to another study, 40 hours a month is spent on searching for equipment. Well, if you use a tracking system, it reduces a nurse's time spent searching for equipment with up to 60%. That's 24 hours a month, which you can use on taking care of what you should. Then going down to savings. A hospital in Texas achieved a 30% reduction in rental expenses, a 20% reduction in equipment purchases, and a 10% reduction in equipment maintenance cost by using asset tracking to manage the medical devices. This is just savings. Now, coming to safety, these are some, I would say, horrifying numbers we're going to look at. Now, health workers often have to deal with rudeness or even physical assault. In 2018, 23,000 cases of violence were recorded in French hospitals. That's France only. And last but not least, the soft factors, and that's really hard or easy to forget when you look at numbers. But according to the same study, nurses express increased well-being since they can track a colleague in need of help. So it's not only you feeling safer when someone can track you and when you're in distress, your colleagues feel better when they know they can track you. Okay, so now look at the demo. And that demo is done on Lunds University Hospital, where we have been locating staff and equipment. But before we show the demo, let's go through the system and you will recognize most of it. So to the left, you have the SeedStudio trackers. What they do is they would listen to all the Wi-Fis in the hospital. It uses the information, which is MAC addresses, signal strength, and device ID, send it through the LoRaWAN network to the backend of our IoT tracking platform. Now, what we do is the brains. We send down to Combane Location API, which is our sister company. There is all the calculations done. That's where the maps are stored. Combane then sends back the data, and we can present it to the very right in Traxmate dashboard. So you can say that's where you consume all the information you have. That's where you can set up the rules, etc. It is also possible to send the same data to the customer interface of the customer existing system, because some customers want to integrate this directly without having two separate systems. Okay, so what does it look like? Let's play. This is one of the buildings in the Lunds University Hospital area. And here you can see a lot of different devices and also the staff. Some of them going to move and some of them obviously going to stand still. The movements jump. That's because we send the location every 30 seconds to 1 minute. You can see from different angles, which is very, very convenient if you want to find something easier. Also, you have the possibility to turn on heat maps. And with the heat maps, and I mentioned it before, you can do some really good optimization. You can see where things or your staff have spent most of the time. And by that, realizing that, okay, this is a crowded place, or this is not where they should be, or this is where they should be. But you also have the tracks. And with the tracks, you will be able to see if they have to run around looking for things, which is just spending time, which we have concluded already. So this is a convenient setup where we're using the complete system to really help the hospitals, both with efficiency and with safety. This was all for me. So Ingi, Kevin, anything you want to add before we go to questions and answers?
Yeah, I think perfect. I'm good. Would enough to, yeah, anyone have questions? Yeah.
So I hand over to Dario to organize these. And Dario, you're on mute for the moment.
Thank you very much again. So really nice presentation. I was really impressed by the market data. They're impressive, and the impact is can be huge of such a solution. Can actually, and this is only was, let's say, related to the healthcare part of the business, let's say. But if you consider also, like, for example, all the structure management, so the cleaning of the room, this information can be useful for many other kind of optimizations. And so it's time for question and answer. I invite our attendees to write to use the chat. You should have you should find the button with the chat. So if you have question, please use the chat of the webinar. But I have a question. This is I don't know if probably yes to Andreas about the setup. So at the beginning, when an hospital or a clinic wants to set up the solution, what do they need? They need the map. How much time does it take? What is needed to start?
Yeah, very, very good question. So to begin with, we use the existing network, and that just to start with that is not spending so much money in setting up a specific network. So that's number one. That's one of the circumstances. Then you do a survey. So you walk around the building, and what this does is collect all the network data, the radio environment, which is then mapped on the physical map, a floor plan. That you integrate into the platform. And when you've done that one time, you're ready to go. Then you can walk away with the seed trackers, and you will track everything using the LoRa connection.
And how long does this first phase take?
Well, it
More or less?
absolutely totally depends on the size of the area. Yes, and
Sure.
the complexity. If there are a lot of small rooms, that will take longer time. But we did a shopping mall this 2 weeks ago that was 60,000 square meters, and it took us 2 hours.
Oh, yeah, great. In the meantime, I'm looking at the chat, and yes, first question is who I should contact. I see that already Kevin and Ingi share their email address. Of course, I also invite Andreas to do the same, to write in the chat there his contact, so he can be contacted. And I also invite everyone to, let's say, connect on LinkedIn, for example, with our speakers, with myself as well, if you are interested in this solution or other IoT solution, because as you've seen, the potentials are great. This is just a use case for healthcare, but tracking can be extremely useful also in other sector. And SeedStudio provide a wide range of devices, not just the amazing Sensecap. And LORIOT as well. Our solution is very wide range in terms of sector we can help with. Second question is, I think this is for Kevin. Can we combine Bluetooth, Wi-Fi location with both the T1000 and Traxmate?
Yeah, I think this question may be for both Traxmate or for me. Yeah, for the hardware, it has a capability to scan the Bluetooth and the Wi-Fi and the GPS. But the standard firmware for now is set to anyone. But we can do customization if you want to combine like the BLE together with GPS or BLE together with Wi-Fi. That's something we can do, yes.
And from my part,
yeah, sure.
sorry. From my part, relating to the same question, yes, of course, we use all, as I said, hybrid. So we use both Wi-Fi and Bluetooth if it is available, which of course will increase the positioning accuracy.
Yes.
We're talking about 2 meters or less, no, in terms of accuracy.
Yeah, 2 meters is the best you can get, at least for now.
Okay, great. Another question for Kevin. Does Sensecap T1000 support all LoRaWAN networks, public and private networks?
Sure, yes. Yeah, because it's a standard LoRaWAN devices, so it's decoupled from the device side, gateway side, and the LoRaWAN server side. So it can work as public with public LoRaWAN operators or private LoRaWAN network.
Yeah, and in this sense, I don't know if Ingi wants to add something about our solution.
Yeah. So we can as well, as Kevin mentioned, it can work with public and private networks, and also with LoRaWAN, you can do roaming. So many people choose to have a private network for their own hospital, and then they can also use a roaming hub to then connect that to public networks. So if they want to cover a wider area, they can also do that as well.
Thank you. Another question, I think this can be addressed to Andreas. Could you please elaborate on the floor mapping you spoke about?
Yes, sorry. for all buildings, you have a floor plan, and which you saw in the film clip that's from above. It's 2-dimensional, where you have all the rooms. So that's what you use when you do the survey. You put the floor plan in the system, in the Traxmate IoT tracking platform. Using that and an Android phone with a camera and AI algorithms, you can walk around in the premises and that collects the data. So that's the combination with floor plans. I hope I'm answering the question.
Yeah, please, if we don't or you need more details, keep asking. So, for example, I see Jose Antonio. Well, it's commented on your previous answer, and yes, I think it got perfectly the idea, and also Vadiraya. Thanks from her or from him.
Thank you.
For the answers. We talk about the accuracy, and we haven't talked, or maybe yes, Wi-Fi, Bluetooth, because I have taken some notes as well. So yeah, this is also important. I think it's the how many times the sensors can send the location, no, the tracking signal.
Yeah, I think this question I can answer. For device side, the interval of uploading the data can be configurable. So the minimal interval would be 1 minute, and yeah, you can set to 10 or even longer intervals to save batteries.
This changing in case of the if you press the button is in that moment, right? It's on demand.
Yeah, you can press button and it can instantly upload one data packet.
Thank you very much. Any more question from our audience? Yeah, there is one. What's the minimum size of the asset you track? Yeah, this question, I don't know who direct this question, probably Kevin.
I can jump in here.
Yeah,
Basically the
what do you
tracker
want?
is the size of a
What
credit
do you
card.
want to track? Yeah, it's just that size tracker. You can attach it to anything you want, like a box or package, logistic, or pet or a person. So that's something it can do. But for even more smaller ones, smaller than this one, I don't think I will say that's a barrier.
Yeah, Kevin, can you show also please the thickness on the other direction, because it's very small. It's like this exactly. It's extremely thin as well, so it's very it's easy to use in different cases.
And the button, the LED, and the double click, it will be go into panic mode, and then that's how you interact with it.
Yes, also in this case, you can imagine how many use cases it enables, and not just in the healthcare sector.
And to comment on that, it's kind of as we were mentioning before, there's multiple use cases you can use with the one network. What we're seeing now in Spain is a lot of grocery stores are using stickers that can basically be stuck on, so it's super flat, very thin. So you can use that for the smaller devices, and then the SeedStudio tracker for the people or larger things like that. You can combine the two within the one LoRaWAN solution.
Yeah, I think this is also a very good point. All the solution, all the components, they are, let's say, agnostic in terms of the other components. So, of course, SeedStudio device works also with other network providers, with other network server providers, and the Traxmate platform works with a wide range of devices, and LoRaWAN management system as well works with different devices and different platform. Of course, this is the best combination, I would say, but this is, let's say, always the customer leads in the election of the components. Thank you for this demo from José Antonio, very informative and lots of ideas to work on. So we hope we can hear from you soon, José Antonio. And if there are no more questions, I will wait. Oh yeah, there is one. They are playing with me, no? Every time I ask, there is one more question. How do you decide on the location of the Bluetooth beacons with the building?
Yeah,
This
I can
question
answer
is
that.
for
Or
Andreas. Yeah.
yeah, I think
Yeah.
so. So what you do when you do the survey, the radio mapping, meeting the physical mapping, you will always see the radio density. So you're going to have a heat map of the radio density, meaning you will see where the radio is weak. That means you're going to have a not so good accuracy, and when the radio is strong, you're going to have good accuracy. So what you do is look for the weak spots, and there where you should mount the Bluetooth devices or the Bluetooth beacons. Also, it's good to have one in each room, but that depends. So first do the mapping, understand the circumstances and what you have today, and then you can look how to complement.
I hope this answer the question. I wait for a feedback. Yeah, there is an additional question. Which tool to use for radio mapping?
So there we have an app. It's developed for just a common Android Pixel phone, and you just use it and walk around. Here you can see a Pixel phone. It's a phone. You just use it. You walk around. You turn on the app. At the same time, you will turn on the camera. You set a point. This is where I start, and then you walk. And every second, it will scan the radio network, and it will say, standing on this specific point, I hear all of these Wi-Fis or all of these BLEs. And then there's a specific point with a specific ID. And then 2 seconds later, when you walk, it does the same. So every 2 seconds, scanning the radio network, putting it on the physical map, and then when you go out and when you use the seed trackers, it will report the information it hears on a specific point. That is compared to the data in the database, which will then return to you, okay, with this information, you're standing here in the building.
Thank you very much. I think it was extremely clear as an answer. Any more questions? You've got anyway the contacts of our speakers, so you're free to get in touch and ask additional question also in another moment. If there are no more questions, yeah, there is one more question. There is one more question is, if using Wi-Fi for indoor locating, does Sensecap T1000 need extra infrastructure?
I'll take this question. So I don't think so, because the Wi-Fi scanning capabilities already built in the hardware by the chip. So you won't need anything to scan the Wi-Fi. The tracker will every time you wake up and scanning the Wi-Fi MAC address, that which is belonging to your surrounded access point like a router. So yeah, you want to be able to add any other infrastructures.
Yeah, I think this answered the question. More question from our attendees. I'm very happy to see so many questions because it means that it's an interesting topic and an interesting use case. Well, if no more question, and I'm waiting a second to finish the sentence. If there are no more questions, I thank our speakers, and I thank you all for being here and attending this webinar. And I also invite you to our next webinars, and mainly to our big event that will happen in Valencia, but it will be also available online. IoT Sparks. To get more info, please visit iot-sparks.com to get more info about this event that is happening in September. And see you next time. Thank you very much.
Thanks a lot.
Pleasure, everyone.
Thank you.
Bye bye.
Thanks for joining.
Thank you.
Take care.
Bye, everyone.